All right, so I want to talk a little bit now about nutrition in pregnancy, and we want to start with before conception. A healthy diet before pregnancy means that we're going to have adequate nutrients available in the first trimester, especially if nausea makes it hard to get enough down. We also want to encourage people to optimize their weight before they get pregnant, because being underweight or overweight can cause some risk. The other big nutrient need before pregnancy is folic acid. Inadequate folic acid is linked to neural tube defects. The neural tube closes before a lot of people are even aware they're pregnant. And so folic acid intake or supplementation is recommended for anyone who may become pregnant. Okay. Energy needs in pregnancy. Average energy need increases about 340 kilocalories more than pre-pregnancy. The amount of optimal weight gain kind of varies depending on pre-pregnancy weight. For someone who is average healthy weight pre-pregnancy, the recommendation is about 25 to 35. Someone who's already overweight, we recommend a little bit less than that, but we don't want to restrict weight gain too much because we can restrict growth. For someone who's underweight, they may need to gain more than that. So severe restriction of weight gain can contribute to poor fetal growth and development, preterm labor, and nutrient deficiencies. But excessive weight that's gained can be difficult to lose and can increase some risk later on. The typical pattern in the first trimester, about 1 to 2 kilograms in that trimester, and weight loss is actually pretty common. After the first trimester, the average is about half a kilogram a week for normal weight women. This sometimes takes place in little bursts, like they won't get anything for a few weeks and then gain a couple of kilos at once. But we want to be cautious about ignoring sudden weight gain. Sudden weight gain should be evaluated. We want to see if they have any other symptoms of preeclampsia. Protein is essential for growth of the fetus, uterus, and the supporting structures, for mammary gland development, to increase the blood volume, to maintain colloidal osmotic pressure, so to keep all the fluid where it belongs in your body, and for the formation of amniotic fluid. So inadequate protein is going to lead to complications. Most Americans have a high protein intake. Patients who are vegetarian need to make sure they're getting complete proteins. That means that complete complementary proteins, because complete proteins are usually animal products. So if they're vegetarian, they're probably taking in incomplete proteins, but they can use complementary proteins to make sure they get all of the essential amino acids. High protein supplements are not recommended. They've been associated with preterm birth. So we just want to have good protein intake, not excess. Fluids, we need fluids for increased blood volume and amniotic fluid. Dehydration can actually contribute to preterm contractions. The recommended daily intake is 8 to 10 glasses of water. Caffeine is diuretic. Excess caffeine is associated with intrauterine growth restriction and miscarriage. It's recommended that we take in less than 200 milligrams of caffeine daily when pregnant. Artificial sweeteners have not been found to have any adverse effects, except that someone who is pregnant and has PKU, they have to avoid aspartame that has phenylalanine. Minerals and vitamins. Most of our nutrient needs can be met by the diet in pregnancy, except for folate and iron. Anyone with no nutritional risk factors should take a prenatal vitamin. They usually just prescribe a prenatal vitamin for everyone just in case. Increased blood volume leads to physiologic anemia. And a lot of women, are already chronically anemic. And so iron deficiency anemia is pretty common in pregnancy, and it's associated with preterm birth. Anemic women are also at greater risk to hemorrhage. They're more likely to hemorrhage in delivery, and they have less blood to lose, so they can lose less blood without symptoms. Iron should be taken with what vitamin? Okay, vitamin C. Sometimes iron supplements upset the stomach, and so we want to encourage people to take those with some food or something when needed. Calcium, there's not an increase in the recommended amount of calcium for pregnancy, but a lot of people don't consume enough calcium. If it's low, then a supplement's recommended. Magnesium deficiency is also common, so that can be supplemented. Sodium needs increase slightly in pregnancy, but sodium intake is not a problem for most Americans. Most of us eat too much sodium. In the past, dietary sodium was restricted to control edema because they thought it would help prevent preeclampsia. It wasn't really effective at doing that, and so that's no longer recommended, but excess sodium intake can increase blood pressure. Adequate dietary potassium is also associated with a lower risk of hypertension, so we want to make sure people are getting enough potassium. Zinc deficiency is associated with fetal central nervous system malformation. Now, a vegetarian diet is not difficult to adjust to make sure that they're getting adequate nutrients, but a vegan diet can be deficient in zinc and in some B vitamins, and so we want to encourage them to replace zinc if they're vegan. Large amounts of iron and folate actually interfere with zinc absorption. Large doses of vitamin A are associated with congenital malformations. Vitamin D deficiency is associated with neonatal hypocalcemia, which can cause some neurologic issues. Folate deficiency is associated with neural tube defects. Pyridoxine has been effective in reducing the nausea and vomiting of early pregnancy, so it can be used for that morning sickness. Smokers need additional vitamin C. So that's the differences for vitamin and mineral intake in pregnancy. We're going to come back and talk about some of the discomforts of pregnancy that can have an impact on nutrition.